Have you ever felt just overwhelmed trying to make sense of all the health advice out there?
Oh, definitely. Eat this, don't eat that, exercise, sleep.
It's a lot. And for health psychologists, the challenge is even bigger, right?
Yeah.
How do we really understand and maybe influence these incredible complex human behaviors, especially when our health is, on the line?
It's a huge problem.
Yeah.
And for decades, the traditional theories in health psychology, while they're foundational, they've often been quite, well, vague.
Vague
Like
how?
simple diagrams, box and arrow type things,
Yeah.
and descriptions in just natural language that aren't super precise. Some researchers even feel this has led to a kind of theory crisis,
A theory crisis. Meaning?
meaning the theories become sort of weak
Yeah.
and they're incredibly hard to test properly, effectively in the real world.
Okay, and that is exactly what we're diving into today. We're looking at a really powerful new approach that's designed to tackle this exact challenge. It's called formal dynamical systems modeling. And the promise here is that it can help us understand how health behaviors actually change over time, like really granularly, and ultimately maybe lead to much more effective ways to help people.
Absolutely. And our main source for this deep dive is a fascinating, very recent scoping review. It just came out online in Health Psychology Review this past September.
Super recent, then.
Yeah, it pulls together the sort of methodological steps and gives these best practice recommendations for this pretty cutting-edge field.
So our mission today is basically to unpack this concept, explore its potential, and figure out where the field is right now.
Exactly. Let's break it down.
So to really get a handle on this theory crisis idea, let's think about the problem more closely. We know that things we can change our behaviors, like smoking, physical activity, diet, they're huge contributors to getting sick early or dying prematurely.
Right. Major public health issues.
But traditionally, health psychology has used what the review calls a low-resolution way of measuring this stuff.
That's a good way to put it. Think about it. A lot of studies use those one-off surveys, cross-sectional surveys.
Yeah, snapshots in time.
Exactly.
Uh,
And they're great for seeing general trends or, average effects across a big group of people, but they miss something really crucial when it comes to your behavior individually.
Because real health behaviors, they aren't static, are they? They fluctuate, they change in complicated, nonlinear ways.
And often very idiosyncratically different from person to person. They show real complexity. They act like these interconnected systems.
With feedback loops, yeah.
Precisely. Like, think about the link between how much you move and how well you sleep, or how your confidence, your self-efficacy might influence your mood, and then your mood feeds back into your confidence.
Ah, okay. Those loops.
Yeah, those recursive relationships, those within-person dynamics. The older, more static research methods they just can't capture that richness adequately.
Right. So enter dynamical systems modeling.
Exactly. At its heart, a dynamical system is really just any system that changes over time because of different inputs.
Okay, simple enough concept.
And formal modeling is the process of taking those sometimes fuzzy natural language theories.
The box and arrow diagrams.
Yes. And translating them into concrete mathematical frameworks. So things like equations or logical statements.
Ah, okay. Making it precise.
That's the key. It allows for precise, verifiable models. Now, this is a bit different from, say, machine learning, which is fantastic for prediction based on data. Formal modeling is more about deepening our theoretical understanding.
Gotcha. Theory testing, not just prediction.
Right. And this dynamical systems lens, as the review calls it, is just crucial for bridging that gap between our current, sometimes abstract theories and the kind of amazing high-resolution measurement we can get now.
From things like smartphones and wearables.
Exactly. We're collecting so much data on our daily lives minute by minute sometimes. These models give us a way to actually make sense of that incredibly detailed picture.
That sounds like a really critical step forward. Can we make this a bit more concrete? Maybe walk us through an example. Like, how would you formalize a well-known theory, say Bandura's social cognitive theory?
Oh, absolutely. That's a great example. So Bandura's social cognitive theory, SCT, it basically proposes that our behavior comes from this constant interplay between us, the person, our actions, behavior, and our surroundings environment. He called it reciprocal determinism.
Right, I remember that. Everything influences everything else.
Pretty much. And Bandura himself kind of implicitly suggested that human behavior is like a dynamical system with these feedback loops built right in.
Okay, so how do you turn that into math?
Well, the formalization process, step one, is really specifying the constructs clearly, defining the key elements from the theory.
So things like self-efficacy, your belief you can do something.
Yeah, or outcome expectancies, what you think will happen, self-management skills. These become the building blocks.
Okay, define the pieces. Step 2.
Step 2 is translating the expected relationships between those pieces into mathematical equations.
Ah, okay.
So, for instance, you might say the change in your self-management skills over time is a function of, well, your current skill level, maybe any training you get, your actual behavior, and maybe some random external factors or disturbances.
So you're literally writing equations for how these things interact.
Precisely. And then step 3 involves simulating the system. You plug in some plausible starting values for these elements.
Like guesses based on what seems reasonable.
Kind of, yeah, or based on previous data. Then, crucially, you estimate the specific parameters of those equations using real-world data from people.
Okay.
And it's usually iterative. You simulate, compare to reality, tweak the model, simulate again, refining the model structure based on how well the simulations match what you actually observe.
So it's a back and forth between the theory, the math, and the real data.
Exactly. And the payoff here is huge. It's not just making the theory precise. It acts as a direct test of the theory itself.
Oh.
Well, it forces you to clarify assumptions that might have just been implicit before. Things maybe Bandura didn't spell out mathematically. And it lets you test different what-if scenarios in a really rigorous quantitative way. It can lead to real theory refinements.
Okay, so it sharpens the theory itself. But what about practical benefits beyond just understanding better?
Oh, huge practical benefits. One major one is something called in silico analyses.
In silico, like in silicon, computer simulations.
Exactly, computer simulations. These formal models let researchers explore how the system, like a person's health behavior patterns, might behave under all sorts of different conditions.
Even conditions you couldn't easily test in real life.
Precisely. Think about testing certain interventions or maybe even public health policies that would be really difficult or maybe unethical or just too expensive to try out in the real world.
Ah, okay, like virtual experiments.
You got it. And this really helps refine theories further and generate super precise hypotheses that you can then go and test with actual studies.
And for you listening, what seems even more impactful is how this connects to interventions. The review mentions it could accelerate the development of adaptive interventions.
Yes, definitely. Particularly something called just-in-time adaptive interventions, or JITIs.
JITIs, what are those exactly?
They're interventions designed to give you support, like a prompt or a piece of advice, precisely when and where you need it most, not just a generic one-size-fits-all plan.
Ah, so tailored to the moment.
Tailored to the moment based on what's happening with you right then. And to do that effectively, to get robust control for the health outcome you want, maybe sticking to an exercise plan, managing stress, you need a deep understanding of those individual within-person dynamics.
Which these models provide.
Which these formal dynamical systems models are perfectly suited to provide. Imagine an intervention that truly adapts to your unique ups and downs in motivation or circumstances.
That sounds incredibly powerful. So where does the field actually stand right now? Is this everywhere in health psychology?
Well, according to this scoping review, it's still relatively rare, especially when you compare it to fields like engineering or biology, where systems thinking is more ingrained.
Really?
Okay. Yeah, it seems to be largely concentrated within a pretty small number of interdisciplinary teams, mostly in the U.S., it seems. Often teams that bring together psychologists or public health folks with mathematicians or engineers.
Makes sense. You need that mix of expertise.
You really do. And while it's definitely a growing area, the review highlighted some clear areas for improvement.
Like what?
Well, surprisingly, only a tiny fraction of the studies they looked at, like 3.4%, actually involved stakeholders in developing the models.
Stakeholders? You mean like patients or doctors?
Exactly. People with lived experience of the health issue or the clinicians working on the front lines. Instead, many studies just relied solely on existing theories.
Even though we started by saying those theories can be imprecise.
Right. It seems like a massive missed opportunity for getting richer, more grounded insights into the models.
Yeah, that does seem odd. What else?
Another big one is transparency and reproducibility. The review found that only about 10% of the studies actually followed open science practices.
Meaning they didn't share their computer code or detailed methods?
Often, yes. Their code wasn't publicly available. And that really slows things down. It makes it hard for other researchers to adopt the models, reuse them, build on them. It feeds into that wider reproducibility crisis in science we hear about.
Okay, so lack of stakeholder input, lack of openness. anything else?
Yeah, one more technical but important point. A lot of studies didn't clearly explain why they chose certain model parameters, like the time steps where the modeling changes hour by hour, day by day, week by week.
Ah, the time scale.
Exactly, or
Yeah.
the run length, how long
Yep.
they simulated the model for. These details are actually crucial for making sure the model matches the real-world timing and dynamics of the behavior you're studying.
Right, you need to justify those choices. So given all that, what are the recommendations, the best practices for moving forward?
Well, first off, the review strongly emphasizes forming truly interdisciplinary teams. That seems essential.
Bringing the different skills together.
Absolutely. Second, actively involving diverse sources of knowledge, not just the existing academic theories.
So bringing in that clinical know-how and, crucially, the lived experience of participants you mentioned earlier.
Yes, that needs to be integrated much more routinely. Third, embracing open science. Sharing code, sharing detailed model descriptions. That's vital for building trust and momentum.
Makes the whole process more collaborative and verifiable.
For sure. And finally, a really practical point. Improving the readability of the research papers themselves. Making them more accessible to health psychologists who might not have a deep background in mathematics or engineering. If the people who understand the behavior can't easily grasp the model, it's hard for the field to really benefit.
That makes total sense. You need to bridge that communication gap. Okay, so wrapping this up, what's the big takeaway here? It sounds like formal, dynamical systems modeling offers health psychology a really potent new tool set.
It really does. A way to move beyond those static, sometimes vague theories towards a much deeper, dynamic understanding of how health behaviors actually work over time.
And the promise is, well, potentially much more effective interventions, right? Truly personalized support.
That's the ultimate goal. And maybe here's something for you, the listener, to think about. Consider the behaviors you might want to change in your own life. Could be daily habits, could be longer-term goals. What if our understanding of those behaviors, your behaviors, could become so precise, so individually mapped out by these kinds of models that interventions could genuinely adapt to your unique fluctuations
Yeah.
in real time, delivering just the right nudge, exactly when and how you need it? This deep dive really shows us a clear path, a potential path towards that kind of future.